I would like to invite on stage Major General Professor Dr. Atul Kotwal, former Executive Director, National Health System Resources Center, Ministry of Health and Family Welfare, Government of India, to come on stage and give us an opening remark for this award ceremony. Please join me in welcoming him.
Good afternoon, everyone. Thank you, Dr. Naveen Nishal and your entire team for giving me this honor to be here among the doyens of the dental surgeon fraternity. I can see a lot of my old seniors and also colleagues here amongst you all. It's really truly an honor to join in this celebration. I couldn't, attend the morning sessions and all. I was in Niti Aayog in a meeting since morning. Why I'm starting sharing that, because a very interesting thing happened, that discussion was on elderly care, and it took us an hour to finally mention by anyone about the dental care and oral care when we talk of, in home visits, what will be done in the whenever they visit any facility, any kind of interaction, or at the healthcare facility. So that dental care has to be brought in as part of the regular package as such. So that's something, a lot has been done by the Government of India in improving the dental care services at all levels, but much more needs to be done. So I'll just share with you a few recent initiatives, what is being done by the Government of India at the primary care level, at the sub-center and PHC, which you all are aware now being converted to Ayushman Arogya Mandir, and CHC and DH. So these are three main, primary, secondary, tertiary. DH is secondary most of the cases. There's many of district hospitals which are providing tertiary also now. The Indian Public Health Standards 2022 clearly define the essential as well as desirable, not only for human resources, the dental surgeons, dental hygienists, dental assistants, dental technicians, but also what all procedures will be done so that essential consumables can be provided at these levels and with a minimum number of OPD load also. And why that number has been given in 2022? Because NHSRC finalized these IPHS 2022 based on consultations with all the experts. I think 2 or 3 faces I can see here who were part of the oral health guidelines also, made by NHSRC at the primary and secondary level. So these services are now being mandated for all the states, that they have to make sure that these services are available. IPHS, there's a toolkit by which every facility is already assessed once. It's a self-assessment tool. So sitting in Delhi, we can see, or sitting in states, wherever the state officials can see which facility has dental chair or consumables are available or not, what all type of procedures they can carry out. So at PHC, it is desirable dental surgeons, but then at many UPHCs, if you go to several states, dental surgeons are available and they are doing routine treatments, except of course the RCT and of course the other implants and all. But at dental district hospital level, complex surgeries also are being done, and these HR are available, including dental hygienists as well as technicians and dental assistants. CHC is another area which states are now focusing upon to strengthen. So with that, the availability of these services will be there, because till now, and the reason for this delayed, uptake in the public health system for dental is that earlier everyone thought that, okay, oral care is separate and systemic body care is separate. But as you all know, about 20 years ago, the papers started coming and all the evidence generation was there, and everyone knows that they're linked to the systemic diseases with the oral health, which you all are aware. Another fillip given to the entire oral health care is by the Government of India by the screening for the oral cancers. 3 cancers are being screened at the Ayushman Arogya Mandir level, and the one of those is oral cancer, oral, cervical and breast, these 3. So that oral cancer screening is an opportunity to everyone to look at the entire oral cavity. And that we are encouraging, and in the training of all the CHOs and ANMs, the staff nurses and MOPHCs, it is being reiterated that don't look only for the oral cancer lesions while screening. Also look at the dental, also if the dental surgeon is not there, look at the gums and look at any other abnormality if you see, and refer accordingly or provide treatment to the nearest facility. So that's how it is being strengthened. At tertiary care level, again, upgradation of medical colleges and hospital services, and also teledentistry and e-health under e-Sanjeevani it was piloted, and that is also being coming up now. PMJ, as you all are aware, that has been added. Now the packages are there as such, and even for above 70 of the senior citizens also. And for the complex surgeries, of course, there's no OPD in that, and there's no simple procedures. The complex surgical ones, or maxillofacial surgery and implant, those are available. The National Oral Health Program, it is again linked closely with the tobacco control as well as the NP-NCT. That's where the oral cancers come in. So going ahead, I think I'll request you all, wherever you are working, to be champions of, whenever you are treating, whether in private sector or in government, also work for the community, work with the schools, work with the colleges, work in the communities, wherever the government health facilities are there, to be champions for the oral health care, for IEC and behavior change communication, because that becomes very, very important. And that's why the community dentistry, I think, even if you are maxillofacial surgeon or any other specialty, the community dentistry has to be very, very important and done by everyone, by all of us, so that these practices are there on ground, which reduce the need for the treatment later on, or at least it prolongs the healthy teeth which we all have. Another is, the skill development for all the other mid-level. Not only those who are working in the dental as qualified dental surgeons, the CHO, the staff nurses, ASHAs, ANMs. So wherever you are, if you can form some groups, ask the government, and every state government is very happy to give permission. Train them, have regular courses. If required, the dental your association can make some short videos and all also, which can be then disseminated. The government can put it on their LMIS or training management system, which can be seen by everyone whenever any patient walks in. So the complete examination, generally they may palpate, they may measure the blood pressure, they'll do the blood sugar testing, but oral, they generally is not done. So that's why, it's the capacity building of those, and inculcating that habit that, okay, whenever any patient comes, see from head to toe the entire examination which is required, and that kind of capacity building also in case required. And so that's why the public health and dental institutions have to work together in this country for the overall, when we talk of achieving universal health coverage, so that oral health should be part of it. That's why I started this talk with this morning's discussion, that once we started discussing, then they said, no, we need to, it's written in guidelines, but actual training about the care of the oral cavity and teeth and all for the elderly, and then we started discussion about the other age groups also, and that is what is required. So to all the awardees, I don't know the criteria of what awards and all what were used, but I'm sure initial past interactions with the Voice of Health team, they would have definitely had some strict criteria and judged. So I must congratulate all the awardees for this. And I must, remind you that excellence in clinical work and all also must go hand in hand with compassion, ethics, and community service. That's my request to you all, not only awardees, rather all. And I would also like to share one other thing with you, that as NHSRC, I was there for 4.5 years. My last working day was 14th of September last month, just 1.5 months ago. I was the largest employer under one roof of dental surgeons who were so, but of course with a caveat that they were not practicing dental surgery. They were all MPH qualification or MBAs after their dental. So, but yes, the quality of our guidelines for oral health care at all levels, including training manuals, were excellent, because I had in-house expertise as well as the experts whom we used to call for the expertise. And so must utilize dental surgeons wherever they are. And the problem with the states right now is, you must be wondering that I've mentioned about IPHS and all, that they have to be there. Why people are not getting employed? The problem is funding. But now, for the next 5 years of NHM, as per the cabinet note and all, which is being prepared right now, I was part of that, this thing. What we are requesting the government now is to take out the fund for infrastructure from NHM and create PM Abhim version 2, and give a lot of other infra and all from other projects, so that more funding on the HR, so that all these essential elements are employed by the states, and desirable wherever there's a community needs is there, they're also employed. So hopefully in a year or so, the things will improve and people will start getting employment as per the IPHS norms. So just as we move forward towards the Ayushman Bharat of the 2047 vision, the integration of all such services together for universal health coverage, that should be our aim. And I would just reiterate once again that community, i.e. information, education, communication, behavior change communication, and also early recognition, that I think needs to be inculcated, and that message has to be spread by all of us and together. So once again, congratulations to all the awardees. Wish you all the very best. Thank you. Jai Hind.
Thank you, sir. I would request you to kindly stay back, and I would like to invite Dr. Naveen Nishal to please come on stage and felicitate our chief guest for the award ceremony. Can we have the memento, please? Ladies and gentlemen, let's give them a huge round of applause.